All right, we're recording. Hi again, welcome to our monthly module series. Today's topic is Citizenship Waived Medical, also known as CWM. And we are going to be sharing some basic information about the CWM program, as well as some new program updates as of this year. And I'll start with some introductions. My name is Tanya Curiel. I am the Regional Outreach Coordinator for Central Oregon. And I am joined by my wonderful support team of Jessica. Jessica, if you want to introduce yourself?
Hello, everyone. My name is Jessica Diaz, and I am your statewide provider outreach and engagement strategist, and also here as support for Tanya today.
Thanks, Jessica. Jessica will be the one answering all the questions that I don't know the answers to, so thank you for being here. Alrighty. So today we are going to cover an overview of what CWM is, talk about some additional services that have been added to the CWM benefit level, and defining what an emergency is, and talking about a form used for non-covered services. And then we'll have some time at the end for your questions, although you're welcome to add your questions in the chat or in the questions box at any time throughout. I can't promise that I will stop to answer them at the moment, but if it feels relevant, then I'll ask Jessica to interrupt me and then we can address them out loud if it would benefit the whole group. Alrighty. So first things first, we want to set the stage for what CWM is and how it relates to the other OHP programs that we have. We'll start with OHP Plus, which is the one that you probably know the most about, the comprehensive benefits that most people who meet traditional Medicaid eligibility requirements get. So sometimes that's called full OHP. CWM is a more limited scope of benefits. It's traditionally emergency services only, and it is primarily for people who do not have a qualifying citizenship status and who currently do not fall into the Healthier Oregon age range. And we'll talk about Healthier Oregon later as well. CWM Plus is a program that is for all the people who are eligible for CWM but are pregnant or for 2 months after their pregnancy, and this gives them full OHP benefits. And then we have Healthier Oregon, which is for adults who are between the ages of 19 and 25 or 55 and up, who are now eligible for the full OHP plus benefits, but now regardless of their immigration status. All right, Citizenship Waived Medical, also known as CWM, is a type of Medicaid benefit for individuals who are between the ages of 26 and 54 who live in Oregon and do not have a qualifying citizenship status, and it provides emergency services. You may have known it in the past as CWM, sounds the same out loud, but written with an A, and we've updated the term or the acronym, and now it's been shortened to Citizenship Waived Medical, and we'll be updating old resources. So you may still see it in old documents, but we're planning on updating everything as we're able to. Okay, CWM Plus. So as I mentioned, CWM Plus is a pregnancy benefit. It is for people who are eligible for CWM, but it provides them with full OHP benefits during their pregnancy and for 2 months after. There are currently no changes to this program. So what you know about the program is still true. Things have not changed. People still have benefits, full OHP benefits throughout their pregnancy and 2 months after. And there hasn't been a change, so I think there's a comment in the chat about it going back to 2 months. That hasn't changed. This is different than the year postpartum. That does not apply to CWM. That's through REA. And Jessica, maybe you want to add a little to that to clarify, because I see several questions.
Yes, I do want to clarify. OHP Plus for pregnant adults outside of the CWM program did expand to be a full 12 months after a pregnancy ends. Unfortunately, this has not yet at any point included CWM Plus. It might look like it is included for CWM Plus because we're in the public health emergency, so benefits are staying on and they're staying upgraded, but that's due to the public health emergency flexibilities and not due to that other change, which I know is confusing, but they're both present right now, so they look the same. I hope that helps.
Thanks for clarifying that. So yeah, OHP plus 12 months, CWM plus 2 months. Thank you. All right, and if there's further questions, please pop them in the chat, in the questions box, sorry. I need to get better about remembering that it's a questions box. All right, next we're gonna talk a little bit about Healthier Oregon. I hope that most of you have heard about this, and I hope that this is repeat information, but if it's not, Healthier Oregon is the expansion of full OHP plus benefits to individuals who still meet the same income and other criteria for full OHP, but in the past did not qualify because of their immigration status. And currently we have an age limitation to it. So this is only for individuals that are between the ages of 19 and 25 or above 55 years old. So for example, in the past, a 22-year-old without a qualifying immigration status could only get emergency benefits or CWM. And as of July 1st of this year, that person is now eligible for full OHP. All right. And since now you know that CWM members would be eligible, that fell into that age group of 19 to 25 and 55 and up, are now eligible for Healthier Oregon, what we did is do an automatic transition of people who are on CWM and are now eligible for Healthier Oregon. We transitioned them all into full OHP benefits on July 1st. So you may be seeing people that are getting those benefits automatically. So if someone wasn't on CWM when this happened, but they're eligible, they can still apply. But just know that this transition happened. All right, now we're going to jump into the program updates. So what has changed? There's been an expansion of CWM coverage as of January 1st, and CWM now covers 3 new things. It covers end-stage renal disease, behavioral health crises, and cancer. There are still some system updates that are in progress to help bills go through successfully, and we're working on that, and we'll hopefully have updates on that soon. But just know that as of January 1st, this is new CWM coverage. And we'll talk about each of these in a little bit more detail. All right, first program update is end-stage renal disease coverage. What is covered now is outpatient dialysis, continuing coverage for emergency and inpatient dialysis, and medications that decrease the body's immune responses after a kidney transplant. Some things that are still not included are drugs that are given while someone is going through dialysis and kidney transplants. All right, behavioral health crises. What is covered? So now crisis counseling is covered and medications to stabilize the crisis. We'll talk a little bit about medications later, but just note that these medications will require a prior authorization. And what is not included is ongoing behavioral health treatment. And what is a behavioral health crisis? Behavioral health crisis is actual or perceived urgent or emergent situations, situations in which an individual's stability or function is acutely disrupted, and when there's an immediate need to resolve the crisis to prevent worsening of symptoms, referral to a significantly higher level of care is needed, or death. And the definition for the behavioral health crisis is found in the Oregon Administrative Rule that is referenced on the slide. Cancer. So the new cancer coverage is treatment of cancer, the side effects, comorbid conditions, and complications of cancer treatment. And this applies when, if left untreated, it would place the patient's health in serious jeopardy, cause serious impairment to bodily functions, or serious dysfunction to any bodily organ or part. Unfortunately, what is not included in this cancer coverage is initial and final diagnosis, but we did want to share a couple of other really great programs that do provide coverage of the costs of breast and cervical cancer screening and services. So the first one is ScreenWise, which has some criteria needed to qualify. And you can click on the link on the screen to learn more about the ScreenWise program and the requirements for it. And there's also the breast and cervical cancer treatment program. Um, Individuals don't necessarily have to be involved in ScreenWise to be eligible for that, but it does help pay for some of the costs associated with diagnosing and treating breast and or cervical cancer. So those are some great options that you should keep note of. All right, and now pharmacy and CWM. So all CWM prescriptions require a prior authorization from a provider. So the provider needs to approve it before it can be paid for. And here's what you can expect with pharmacies. If the prescription is for a condition that is not covered, the pharmacy should tell the patient that the drug is not covered by their Medicaid plan. If it is the prescription is for a covered condition or the diagnosis is unknown, the pharmacy should tell the provider that they need to complete a prior authorization. And if the prescription is for a behavioral health drug that was prescribed as part of the emergency visit or alongside a crisis episode, the pharmacy should call the Oregon Pharmacy Call Center to provide an override. So this is information about CWM prescriptions, basically saying that they require prior approval from a provider. And just one second, because my computer likes to freeze every once in a while. It's back. Thanks. All right, and this update applies mostly to providers. So if you don't have MMIS update, it's probably because, or MMIS, excuse me. If you don't have MMIS, it's probably because you aren't a provider. So this might not apply to you, but for providers on the call, just know that when the system updates are complete, we will let you know and then update the list of CWM emergency diagnosis codes. But in the meantime, for behavioral health and cancer treatment, providers should wait to bill OHA for these services until the codes are added to MMIS as covered CWM emergency codes. And if they do choose to bill for these services earlier, OHA will deny the claims and reprocess them in July. And there are certain
I just
procedure
noticed,
codes.
sorry,
Oh,
we
yeah.
should have updated that from July. July has passed.
Oh, yeah.
My bad. That's on me. I put that content in.
Sorry for
So
not.
I think some of these are taking a little longer to get fully into the system, so it might be in the next couple of months. And then the things that are already in the systems have been reprocessed. So it's an ongoing process. We're getting things slowly but surely fully into those systems. So sorry. Thanks for letting me interrupt.
Thanks for interrupting, Jessica. And goes to show, I am still thinking it's July. I'm not ready for August. All right. And if you have questions, providers should call provider services, and then members can contact client services. All right. And to the definition of what is an emergency. So beginning July 1st, 2022, CWM members can get emergency care for a medical condition that they reasonably believe is an emergency that requires immediate medical treatment. We are doing this through something called admit diagnosis codes. So in the past, someone would go in and the service would only be covered if the final diagnosis was thought to be an emergency. So for example, severe chest pain. But now it is covered if they go in and think it's an emergency, even if the final diagnosis is not an emergency. And we'll talk a little bit more with some examples. All right, and here is the Oregon Administrative Rule definition. It's a long and wordy one, so bear with me while I read through it all, but I think it's really helpful to understand what this new definition of emergency medical condition is. So a medical condition manifesting itself by acute symptoms of sufficient severity, including severe pain, such that a prudent layperson who possesses an average knowledge of health and medicine could reasonably expect the absence of immediate medical attention to result in placing the health of the individual, or with respect to a pregnant person, the health of the person or their unborn child, in serious jeopardy, serious impairment to bodily functions, or serious dysfunction of any bodily organ or part. An emergency medical condition is determined based on the presenting symptoms, not the final diagnosis, as perceived by a prudent layperson rather than a healthcare professional, and includes cases in which the absence of immediate medical attention would not in fact have had the adverse results described in the previous sentence. That's not plain language, I apologize, and I will try to plain language it, but basically it says if someone who kind of knows what they're talking about but is not full-on medical professional thinks that there's an emergency going on that could really impact someone's body or could lead to them dying, they should and will be able to seek out medical care, and it will be covered, even if they're not 100% sure if it's like a life or death situation, but if they really think it is, then it'll be covered. And that was not a very professional definition, but hopefully that helps explain. And here's a better example. So a 40-year-old man has chest pain and goes to the emergency room. He only has CWM coverage, and the admit diagnosis, or what they diagnosed him when he went into the hospital, was chest pain. But the final diagnosis is acid reflux. As many of you might know, is not a life-threatening condition. But the 40-year-old man really thought he was experiencing an emergency. So under this new emergency definition, this is covered because they really thought it was an emergency. So that's nice to hear that someone can confidently go in to a hospital if they think that they have an emergency and have that covered and not worry about not knowing enough about medicine to know if it will be a true emergency or not. All right, and we also have this slide that has some provider resources. So if you're a provider and want to learn more about billing or codes or other information, you can find all of that on this slide. The last thing that we're going to cover is something called the OHP Client Agreement to Pay form. And this is a form that's needed to be filled out by the member in order to bill them for non-covered services. So a provider must complete the form for medical treatment before providing a non-covered service. So in the past, this was recommended for CWM members, but as of July 1st, this is now required. And there's the forms that are, there's Form 3165 that is for medical services, Form 3166 for pharmacy services, and Form 4109 for planned community birth services. As I said, a provider must complete this form before billing any OHP or CWM member, and they must keep it on file. If it was not completed, they cannot bill the member. So if someone's unsure about whether something is a covered CWM service, they can reach out to client services or call provider services if they are provider. And this is what that form looks like. For the medical portion, this is Form 3165. And the OHP Client Agreement to Pay form is available in English, Russian, Spanish, and Vietnamese, although we are working on translating it to Somali, Arabic, Korean, simplified and traditional Chinese, and Romanian. All right, that is what we had to cover today. Short and sweet. and hopefully useful information on what some of the new program changes are. I see that there are some questions in the chat, and I'm not sure if any of them would be helpful to read out loud. I know you've been answering them, Jessica.
Did also, I didn't tell you this, Tanya, but we have a subject matter expert who is also watching and has some notes that she sent my way too
Oh,
to make
yes,
sure
please.
that we're all speaking the same language. And she helped with a definition of what a comorbid condition is, which is it's two or more conditions that occur at the same time. So it has a pretty broad definition. Um, and if people have specific questions about what that means for COWM, that's the kind of thing that probably would want to be dealt with individually. She also clarified that when we talk about a prudent layperson, by prudent we mean someone is able to make a reasonable medical decision, and we are trusting members to make these decisions about their health needs, and that's a way we've been able to widen that definition of emergency a bit more than it has in the past. I also have a question about, does COWM cover emergency transportation to the hospital? And the answer is yes, as long as the service itself is covered by COWM when they arrive. I think that's the slight limitation there. But yes, it can definitely cover emergency transportation. At this time, COWM does not cover any non-emergent transportation. So there's a whole bunch of questions that I went through really quickly. We have a question about flyers that cover the new COWM coverage. We do have something that's very close. The first resource on that resource slide was a member-facing COWM fact sheet that you are welcome to use and to share with your clients, and it's up on the public COWM website. I think that's the closest we have to a flyer right now, and so it's more of I think a two-pager, but that should be pretty valuable for you all because we have provider-specific materials and public materials. At this point, we don't have a community partner only guide, so we're using the materials that our good friends over at the rest of OHA. They've been hard at work on materials we can share more broadly. So I'm just adding that plug in too. And does anyone have any questions that I either didn't answer in full or that you'd like us to talk more about? Oh, thank you, Tanya. So this is our fact sheet that's up on the public website. And we're also working on a COWM Plus specific one as well. I think it's almost final. And I do also want to add that we are working on more languages for this as well. Right now it's just in English, but we are working on getting additional languages very shortly.
Thanks. And sorry for the terrible screen sharing. My computer keeps freezing, but yeah, this is what it looks like.
And it does include those new pieces such as cancer, behavioral crisis, and end-stage renal disease. We have a question that is about that member responsibility to pay form, and I will try to do it justice, but I might have to get back to you all because I'm not I'm not a subject matter expert on the legal side of things, but the question is, many COWM members do not indicate they have COWM coverage at the time of service, and the OHP waiver does not get completed. Would these services be the member's responsibility since they did not indicate coverage? And I believe with this change in the rule from being a recommended form to a required one, it does push the responsibility towards the provider instead of the member to identify if someone is on OHP in any capacity, including the COWM programs. And so it would probably be the provider's responsibility to pay if that form was not filled out and a non-covered service was done. I want to make sure I get, yes, okay. My my expert is saying that I have that correct. So this is a change in rule to help protect members. And it is really important to get that agreement to pay form completed for any COWAM members who might then get billed for any services that aren't part of their COWAM coverage. And I hope that makes sense and that helped. I will also offer my services for anyone who is part of a provider organization and has additional questions and wants to talk more. Please reach out to me. I am very happy to talk more about this. I did find that this form, the 3165, is available on our form server. So that's the same place you can find forms like our CP authorization form, that 6610, same place you can find the application itself as a PDF. And we can make sure to get you that link. I often Google it. I just Google OHA form server and it's usually the first thing that pops up. And then I put in the number for the form. In this case, it would be 6135. Did I transpose that? I'm not looking at the form number at the moment.
Yeah, it's 3165.
I'm dyslexic for numbers, I've decided. So my apologies. The official form number, not the one I made up in my head.
Yeah, and I just dropped the link to the 3165 form in the form server.
Oh, thank you so much. Yes, that's the English version of this form that is linked directly.
And I'll give you guys a tip that I learned recently in that if you change the HE to like HS in that link, it'll take you to the Spanish version. And I think that applies to other languages as well.
It does. Spanish is one of the more intuitive ones. Some of them get a bit funky because we go through the alphabet and then it's what we have left.
Yeah.
I see a great point about, like how do we help educate COWA members? How do we help educate providers? And I think a short answer is we love your help with this in both directions. Um, and also that OHA is happy to talk to providers if they are not following what you are expecting as far as, definitions of emergency and understanding what is or isn't covered for COWAM. It's going to take a lot of us doing a lot of work to get the word out. And this today is one of our many attempts to get the word out. I know that there are various places where providers get their information and we are working to be present in those, as well as having that member-facing fact sheet that will be available in Spanish very soon and other languages. And also we'd love to hear from you where you think education may be useful. So there's my plug is please, I'm going to stick my email address directly in the chat for you all. Please don't be shy. We'd love to hear from you about how we can best get the word out about this and other Healthier Oregon related updates as well, making sure everyone feels like they have the information they need to be successful. And I do also see a question about at what point does that form get filled out? So the form about agreement to pay is one that should be given to people who have some level of OHP, whether that is OHP plus, COWAM, COWAM plus. And so it should be filled out by a provider with the client if they have OHP. If they're visible, I would say MMIS would be the place a provider would look to confirm if they have active medical coverage, that is public coverage OHP, and that would, I believe it also includes, of course, all of those non-MAGI programs as well, anything that is under the OHP umbrella. Not sure about Medicaid savings programs, I am suddenly realizing. But I know for sure OSIPM is included in that. So that's the full OHP on the non-Magi side. If someone has no medical coverage, then we don't have any connection to how their billing works here at the state. And I will also say it's always the provider's responsibility to confirm what kind of coverage someone has at the time that they are treating them. And if it turns out someone did have OHP, even if they did not identify it, you cannot bill them.
Any final questions from anyone? All right. Well, thank you so much, everyone, for joining us for our updates on COWM. If you have any further questions, feel free to reach out to us or to your regional outreach coordinator, and we'd be happy to help you out. And I see a couple questions came in. Is there a link to MMIS codes?
Yes, those are currently being updated, so they are in a state of change right now when it comes to CALM, but they were linked on that resources slide. It was one of the links there.
Thanks, Jessica. And thanks, everyone, for your questions. All right, last question. When can nonprofits have access to MMIS? Hopefully.
Ooh, okay. Spoiler alert, this is breaking news here. We're hoping to get that by the end of this year, so more soon. I don't think we have officially
Oh.
said anything yet, so this is our secret, everyone. All 60 people on this call.
That's great news. What a great way to end. Thank you, Jessica. Thank you, everyone, again for your questions. We're here if you have any more after this presentation. All right, have a great rest of your week, and I will close this out.
Thank you so much, Tanya.
Thanks, Jessica.